Hello, everybody. My name is Jennifer Robertson, and I'm the Adult Program Librarian at the Carbondale Public Library. And I want to welcome you to this lecture today. We have a special guest with us. Her name is Katie Lemons, and she is a physician assistant. She is doing a nutrition outreach fellowship through the PA Foundation. And so she has very generously offered to come here and talk to us today about nutrition. So I will go ahead and turn it over to Katie. Thank you so much for being here.
Thank you, Jennifer. Hi, everyone. It's so nice to meet you. I am so delighted and thrilled to be here. So thank you for letting me into your home or wherever you are right now. I am living in Boston. So again, it's such a treat to be able to meet people from all over the country doing this fellowship through different Zoom, different modalities, I suppose. So I'm going to get started with the presentation. If you have questions, please do let me know. I will answer them all at the end. But without further ado, let's get started. Let me share my screen here. Okay. All right, so yeah, as Jennifer noted, I'm doing this PA fellowship hosted by the PA Foundation. This is me. I have my master's in nutrition and I've been working as a family medicine PA for the past year. I started my job about a year ago. Some topics that we're going to be covering today: nutrition for healthy aging, enhanced recovery after surgery with nutrition, as well as nutrition for prediabetes and diabetes. Starting with healthy aging, here are a few statistics just about the general aging population within the US. So 20% of the population will be greater than 65 within the next 9 to 10 years, as well as some statistics regarding the most common health conditions in older adults, like high blood pressure, heart disease, diabetes. The World Health Organization defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older adults. I like to think of it as adding life to years, not years to life. So living well while aging. Some consequences of unhealthy aging, I'm sure we've thought of or heard of some of them, including dementia, impaired mobility, chronic disease, societal disconnection is a big one as well, malnutrition, and that's kind of what we'll be focusing the majority of the conversation on, really honing in on that nutrition piece. Some ways that nutrition can influence aging from an organ systems approach: it really can affect all different organs and affect end organ damage from the cardiovascular system. So from a heart perspective, from a GI perspective, skin, hormones, nervous system, really running the gamut of affecting all different organ systems. The role of nutrition in aging, of course, providing life-sustaining nutrients, helping to treat and prevent chronic disease like the high blood pressure and diabetes, as well as improving quality of life and general enjoyment. With poor nutrition, some physical limitations, decline in thought process, loss of teeth, taste, smell, as well as long-term disease. General nutrition recommendations. So as aging, what I really hone in on in my own practice is focusing a little bit more on protein needs. As we age, there's sometimes a tendency to lose muscle mass, and this term, protein wasting, is called sarcopenia. So we focus a little bit more on making sure we're getting adequate protein intake. Fiber is also really important. Fiber comes from those starchy vegetables like sweet potatoes or cassava, as well as whole grains, quinoa, brown rice, oats, and some other things, like flaxseed, chia seed. Fiber is really important to consider as we're aging. Monounsaturated fats, these are the fats that come from plants, like avocados, nuts and seeds, olives, olive oil, and then of course getting enough antioxidants through fruits and vegetables. As we kind of talked about, really honing in, those are kind of a macronutrient perspective, but honing in on the micronutrients. B vitamins are really important, so vitamin B12, riboflavin, thiamine. Magnesium is also very important, as well as vitamin D. The only one I would also add here that is not yet included are omega-3 fatty acids. So these are the ones that come from fish and from avocado, some nuts and seeds as well. Omega-3s are very important from a brain perspective, from an immune system perspective. So that's also another key nutrient that I like to hone in on with my own patients. As I hinted at, so the general recommendations for population for protein intake is 0.8 grams per kilogram. As we're aging, to prevent sarcopenia, so to prevent that muscle wasting, we want to increase protein intake to 1 to 1.2 grams per kilogram. For me, that's very hard to visualize, and math was never my strong suit, so I'm certainly not going to be over here counting my macronutrients as I'm about to have a meal. I think a really good frame of reference is to think about the size of your palm if you're building out a plate or if you're thinking about sitting down to a meal. And this is really where a lot of mindful and intuitive eating comes into play. You know, if you are in tune with your own body's needs, listening to those internal hunger cues, then this can be a little bit easier as well. So the size of the palm is usually 20 to 30 grams of protein, which is ample protein per meal. I also sometimes like to think of it as, about 20 to 25% of overall energy intake, so overall calorie intake coming from protein. So if you're thinking about, building your plate, you can use the size of your palm or think about it as, 25% of your plate is also an easy way to think about this. It's also really important to note that taste buds do change as we age, and sometimes it may become a little bit difficult to taste the enhanced flavors of food. So there are changes in dentition that make chewing more difficult as well. So all of these things are very important to consider, and something to bring up with your own provider, or something that I talk to my patients about as well. And that sometimes if our taste buds are declining, then we're reaching for those foods that are a little bit more saturated with flavor, which are often more salty foods or sugary foods. What we want to consume a bit more mindfully, a bit more aware of, are the processed foods, as those often have a lot of sodium or trans fats, added sugars, and refined carbohydrates. So carbohydrates are so incredibly important. Carbohydrates are in fruits, they're in vegetables, they're in whole grains. But with the whole grains, as we talked about, they have that added fiber, which is very important not only for your digestive system and your cardiovascular health, but also for blood sugar optimization, because it prevents that quick spike up in blood sugar and then quick drop off. So paying a bit more attention to those refined carbohydrates, so the white bread, white rice, pizza, pasta, cereals, is important as well. And instead, reaching for those whole grain sources of carbohydrates, those that have fiber included in them. Exercise is really important as well to increase lean body mass, increase bone density, improve glucose tolerance, and we'll talk a little bit more about that later when we discuss prediabetes and diabetes. It also helps improve mobility, cognitive function, better sense of well-being, connection, mood. Here are some recommendations. So 150 minutes a week of moderate intensity. This that number to me seems very overwhelming at first, but if you break it down, even just adding in, 15 to 20 minutes of walking, and if you go on a walk with a friend, you're usually talking a little bit more, your heart rate's getting up a bit more, that 20 minutes a day easily adds up to, it totals 140 minutes a week, which is basically right at goal. So breaking it down to be a bit more digestible is very important as well. Strength training is definitely recommended, again, to increase muscle mass, to increase bone density, and really choosing movement that you find joyful that also helps connect to focus, balance, because these things will help prevent falls as well. I'm going to skip that slide. Not included in this conversation that we're having today, but also equally important, and I would be remiss if I didn't mention these things. Really, I talk to my patients a lot about access to nutrient-dense foods, if these foods are readily available to you, and if not, how can we troubleshoot that? Sleep is so important, especially for overall hormone health. Stress management and social connection too is so important as we continue to age. Moving right along, so our next topic is enhanced recovery after surgery. Malnutrition is a very strong risk factor for poor surgical outcomes. These patients who are malnourished have a greater risk of morbidity and mortality, as well as an increased length of stay in the hospital, greater risk of complication, greater risk of infection. So it's really important to think about nutrition before surgery, especially, a week before surgery, as well as 1 to 2 months after surgery. Increasing the amount of high quality protein, because this helps amino acids, helps rebuild, helps prevent infection. So sources of protein can be from vegetarian or non-vegetarian sources. Meats, eggs, fish, soy, poultry, beans, legumes, all excellent sources of protein. And as I said, high protein diet or supplementing with a bit more protein at least a week before and 1 to 2 months after surgery. I found this very interesting. There are a couple studies that look at carbohydrate loading before surgery and resulting in improved outcomes after surgery. So the recommendation was 45 grams the night before. I would definitely recommend speaking to your surgical team if you're thinking about supplementing before surgery, because oftentimes there is the requirement that you're not allowed to eat anything called NPO, or nothing by mouth, before surgery. So that's a conversation you definitely want to have with your surgical team. In regards to visualizing, what does 45 grams of carbohydrates look like? So a single carb serving is usually about 15 grams. And I gave some examples of single carb servings here. So, you could combine half cup of oatmeal with 2 servings of fruit. That would create the 45 grams total, which seems very doable, especially, the night before surgery. Found this very interesting as well. So this goes back to our conversation just about refined carbohydrates. So if you're combining whole grain or complex carbohydrates with a protein, with a healthy fat, the studies show there were no differences in blood sugar variations between both diabetics and non-diabetics. So this is kind of an introduction to our next topic that we're going to be talking about, because the type of carbohydrate is very important, especially in those who are a little bit insulin or carbohydrate resistant, also known as prediabetes or diabetes. Nutrition is also really important for wound healing. So again, going back to this topic of including more high quality protein sources, either from meat, eggs, fish, soy, poultry. These all have really great amino acids like glutamine and collagen. Beans, peas, nuts, seeds, all important for wound healing. And then adding in some more antioxidants from vitamins and minerals, usually from fruits and vegetables, especially those that contain high amounts of vitamin C and zinc. I like to talk to my patients about really eating the rainbow, all different colors, even whites, garlic, cauliflower, onions. These all have really important antioxidants that help speed up the process of wound healing. Adequate hydration, of course, is very important as well. Making sure to drink 6 to 8 cups of water every day. This is kind of a bullet point, a little synopsis of everything that we've discussed so far. More protein, increasing antioxidants in the form of fruits and vegetables. Consider that complex carbohydrate loading. So that means something like, again, a sweet potato, that starchy vegetable, things like brown rice and quinoa and oats. All of these things can sometimes help before surgery. Really honing in on those balanced meals, having a good source of protein, a good form of complex carbohydrate, some fruits and vegetables, healthy fats, maintaining adequate hydration, keep moving, and even increasing caloric density. So increasing the amount that you're eating after surgery to help enhance the process of recovery. Moving right along. So our last topic is nutrition for prediabetes and diabetes. Just a general overview of what diabetes is. It's the impaired ability to utilize or use glucose either from insulin resistance, decreased insulin production, or a combination of the two. There is, as your A1C, which is the level that we use to look at the trend of your blood sugar over the past 3 months, as that starts to raise, we kind of put that in the category of prediabetes. And then when it gets to a certain level, that's when you have the official diagnosis of diabetes. And that's kind of what I'm verbalizing here. We'll usually look at an A1C. oftentimes it's never just one single incidence of a lab value. It's more of a pattern or things that we've seen multiple times during a patient encounter. Some risk factors for prediabetes and diabetes. Age plays a certain role. Family history definitely plays a role. Being a little bit less active, poor nutrition, smoking. Some ways to prevent and manage type 2 diabetes. Increasing your movement, that 150 minutes per week. Same thing what we said last time. Even just 20 minutes of walking, adding that in per day really adds up over time. Smoking cessation. And then what we're going to get into next, some nutrition and dietary modifications, as well as mindful and intuitive eating. Similar to what we discussed in regards to healthy aging, some complications of diabetes, again, really affects all organs and can result in end organ damage across the board. I think it's really important to review what a carbohydrate is. We hinted a little bit at this a little bit earlier on in the conversation, but carbohydrates are not at all bad. They're so important. They're in fruits, they're in vegetables, they're a great source oftentimes of fiber, but we need to be a bit more mindful of what kind of carbohydrates we have, because these are simple carbohydrates that don't have as much fiber, and so those oftentimes are spiking your blood sugar quickly and then resulting in swift declines of blood sugar as well, sometimes known as feeling hangry if you're really hungry. And then there are complex carbohydrates, which have more fiber in them and result in better blood sugar stabilization or optimization. These are the recommended daily amounts of fiber. Many studies that I've read show that most Americans get around 10 grams of fiber per day, and the recommendation is really triple that, so around 30 grams per day. Some benefits of fiber beyond what we already discussed, increasing satiety, feeling more satisfied after a meal, promoting regular digestion, improving glucose control, and helping reduce LDL cholesterol, which is the quote unquote bad cholesterol. I review how to view a food label quite often with my patients. So this is what I look at first. First and foremost, look at the ingredient list. Can you pronounce everything? Does everything look like something that can be found in nature? Or is it a word with 17 syllables that is very difficult to pronounce? The next thing I look at is the order of ingredients, because the order really matters. The ingredients that are in the highest abundance come first. So if sugar is in one of the first 3 ingredients, you know that the majority of the product is likely sugar. And going back to the last slide, sugar goes by many different names, which is why it can be a very confusing experience to read a food label. Here are just a few of the cousins of sugar. So all of these different things essentially boil down to different types of sugars. So looking at sugars is very important on the food label. There was a recent update that now, instead of just overall sugar, there is an added sugar. So that's really what I hone in on next. So reading the ingredients first, looking at the order of ingredients, then looking at those added sugars. I also look at the serving size just to make sure that it's in line with what I originally thought it was. Maybe it's a little bit less, maybe it's a little bit more, but just something to consider. And then lastly, I look at the calories. I think over time, the word calorie has become a bit demonized, but calorie really just means energy. It's a unit of energy. So you want to make sure that what you're eating is going to make you feel full and satiated over a span of time. If something doesn't have enough calories, you likely will be hungry very shortly thereafter eating. I love this visualization, and we touched upon it in the beginning of the conversation, that really filling half your plate with those non-starchy vegetables, so things like Brussels sprouts and cauliflower, zucchini, tomatoes, onions, all of the above, a quarter plate of protein, and a quarter plate of those whole grains or complex carbohydrates, starchy vegetables like cassava or sweet potato. This is a really useful visualization. I also want to include healthy fats in this visualization as well. 1 to 2 tablespoons per meal, and that looks like avocados, nuts and seeds, olives, olive oil, coconut, chia seeds, flax seeds, because healthy fats often have those really great omega-3s, which are important for brain health, heart health, mental health, skin health, healthy fats are really so important. And that's it. That was the whole presentation. And now I want to, I'm gonna stop sharing my screen. Just open it up to if there are any questions. If there are not, I'm also happy to provide my email if certain questions come along later on.
Thanks, Katie. That was super helpful. I actually had a question. I was wondering if you were talking about the surgery and the nutrition before surgery. So that's not something I've heard a lot about. I'm wondering if it's becoming more mainstream in your field to share that information.
Yes. So in my field, yes, but my whole passion is nutrition. I have my master's in nutrition, so it's something that I'm having a conversation with my patients about. I definitely agree with you in that it's not something that's typically brought up, in a surgical setting. When I was on my surgery rotation, this isn't a conversation that I was having very often. This is newer research, so I hope that it will become more at the forefront to really talk with patients about how you can utilize nutrition to help helping to prevent infection and healing faster and reducing the risk of morbidity and mortality. So having those negative outcomes after surgery. So we're not there yet, but hopefully soon, I guess.
Yeah, that's super helpful to know. So I appreciate you allowing us to stream this so our community can have this talk as a resource to kind of refer back to. I was also wondering, at what age does the healthful aging stuff start? Like, I know we should be doing that all along, but like, when do you really need to start focusing on it?
I started having the conversation. Well, usually in most of my patient encounters, I'm taking, kind of a 24-hour food diary just so I have an idea of baseline. So I started pretty early, but even more honing in on it as late 50s into early 60s. And it really is person dependent, which sometimes is why some of these presentations can be a bit frustrating because it's certainly not a one size fits all approach. But if you are someone who has been active their whole life and have a really robust understanding of enjoying movement, you're still working out, lifting weights, then those protein requirements will change a little bit person to person. But in general, I would say, 50s into 60s, 70s, 80s is when I hone in a bit more on that conversation.
Great. That's really helpful. If anybody else has any questions, feel free to put them in the chat or in the Q&A box. Maybe you could put your information, if that is okay with you to share.
Let me put this in the chat. This is my email address. So if you have any questions whatsoever, please don't hesitate to reach out. I would love to connect.
Great. Well, thank you so much for doing this today. We really appreciate it. And again, if you weren't able to catch the whole thing, it will be on our Facebook page and on our YouTube channel at the Carbondale Public Library. So feel free to share it because it's a great resource and we just really appreciate your time.
Of course. Thank you so much, Jennifer. And thank you for everyone that was able to join. Again, it was such a treat for me and what a nice way to start my day over here in Boston.
Wonderful. Well, have a great day.